I'd like to welcome you to our session this afternoon. It's just going to be one moment before we begin. Our topic today, again, is patient collections, 7 mistakes your practice should avoid. And we're going to give everybody a chance to join in. We still have people coming in, and it'll just be another moment. I'm going to be your presenter this afternoon. My name is Ken Edwards. I'm the manager of the Cure Billing Communication Department here at CureMD, and I work with practices every day. And one of the common issues that we face in terms of what we're able to collect and in terms of billing, what part of your revenue as a practice this becomes is patient collections, patient reimbursement, amounts that are being transferred over to patient responsibility by your insurance companies. And this, as we know, over a period of time, we've witnessed the growth of this amount, of how patient responsibility has become a larger and larger part of your overall reimbursement at the practice. So we're going to start off right now by looking at some very basic numbers. What are patient collections actually worth to you, your practice, as a whole? So based on our analysis of practices that we work with every day, depending on your specialty, depending on the area that you're practicing in, anywhere from 10 to 25% of your reimbursement of the monies that insurance companies are allowing you to collect are patient responsibility. What that means for you is that patients are going to need to pay a huge portion of the bill for services that you're rendering to them. And if you're not active in collecting patient dues, if you're not able to collect patient dues in a timely manner, if you're losing out and patient AR or patient accounts receivables are becoming a huge problem within your practice, this is like losing at least $10 out of every 100. You're simply dropping that out of your wallet. You know, you're picking up bills from your wallet and $10 is just going flying out, right? And this amount, this patient due, this patient reimbursement amount is that amount that you're already authorized and you're already approved to collect. So insurance companies, from their point of view, the government, other agencies, everybody's looking at this from money that you're already due, you're already collecting. As far as everybody else is concerned, these are funds that you're receiving, right? So inefficient patient collections will see you losing at least a tenth, maybe up to a quarter of what you're entitled to. And collecting on patient receivables is probably easier than doing a lot of other things that practices try to do to improve their finances. Right? Finances are always tight, especially for smaller practices. Let's assume you're collecting anywhere from $10,000 to $20,000 a month in total. So $1,000 or $2,000 of that is patient reimbursement, and you may simply be losing that by not having efficient policies, by making mistakes that are maybe easy to correct, depending on what you're doing and depending on your practice and depending on the patients that you see. So we're going to talk about some of those things today. Going back to some of the things that you can improve or that you can do to improve your collections as a whole, we talk about coding better or billing for all services that you're rendering, maybe marketing to your patients, trying to get more patient volume through the door. And you're going to be spending money doing all of those things, whereas this is money on the table that you're just not picking up, right? There's other issues at stake. Are your insurance companies paying you correctly? Do you have a good contract with your payer? And is your billing company maybe doing a good job for you? Is your billing team doing a good enough job for you? But all of those things aside, after all of those things are done, that's when you come to this point where you know how much you're supposed to collect from your patients, and it turns out that a lot of practices are unable to. So let's talk about what can possibly help in collecting from patients, in understanding what is it that you're due to collect. So a good billing company or a good billing team within your practice can keep your billing in shape. So that lets you know what you're supposed to collect. You're supposed to collect coinsurances and deductibles. You're supposed to collect for services that are not covered under the patient's benefits plan. You're supposed to collect copays up front, and your billing team, your staff, can help you do that. A good practice management system, and this may be an electronic system like CureMD, or it may be a paper-based log system that you have. People have used this since time immemorial to keep track of what's owed. And so good accounting practices. This will tell you how much each patient owes you right now. This lets you track payment history verify if you have a good practice management system, or if you have staff members that you train to do this, verify insurance eligibility. And a lot of these things can be done quite quickly. They can be done electronically. If you're using a system like CureMD, our system can help you do this on its own so that you're prepared ahead of time. And so having a good practice management system gives you a leg up in being able to do these things. So we're going to shift over and maybe talk about the first mistake that a lot of practices are making. And that's going to be having only a couple of payment options, having few payment options, right? We don't accept credit cards. We haven't signed up with a merchant. We don't have a machine to charge cards. We're not able to, do a direct debit from your bank account. So all we can do is accept cash and paper checks. So what's happening at this point is a lot of patients are coming in and maybe don't have enough, cash in their wallets. Maybe they don't bring their checkbook in, and everybody can say we forgot it, right? But you're giving them an option not to pay right up front. And that's going to be a repeating theme when you're not collecting up front, when you're not giving enough options to patients to pay in the way or in the manner that they can, you're losing out. And a horrifying statistic, every time you delay collection on patient payment by about 10 days, and we've talked to a number of collection services regarding this, every 10 days you lose about 50% of your ability to collect on balances that are due. So making that a habit, making sure that that happens up front, giving as many payment options as possible right from the get-go, makes sure that you can do some of these things and not allow a patient to walk away without having settled their bill. Right? One of the interesting things, so a lot of practices have started this. They've started accepting credit cards. The CureMD system allows you to do that. So that's fairly common, fairly standard. You can get a merchant account on your own as well and be able to charge cards. So accept all kinds of credit cards. The amount that you're paying in terms of that credit card fee is a minuscule amount when compared to the total patient balances that you will have accrued that you will not be able to collect upon if you just choose not to support some cards. So the other option is direct debit. Being able to debit directly from a bank account as opposed to taking a paper check and holding on to it and then going to the bank and then depositing it. And then some time down the road, being able to see that those funds transferred into your account. So again, being able to charge immediately and right at that time when the patient is in front of you, and being able to correct errors and being able to pick up on cards not working or an account not supporting or not having enough funds. That's something that you're able to do, especially with CureMD. So the second mistake is not allowing a patient a discount if they pay the bill in full right up front. So self-pay patients, patients who have a larger balance, this builds really good rapport. So you're giving them a 5% discount if they pay everything up front. You know how you're saving those funds? You're not sending them statements. You're not looking to recoup that money a month or 2 months down the road. They're paying everything right there, so their account is settled. You're not spending time and effort collecting from them or asking them over and over again to pay their balance. And it ensures that they're paying whatever they can right up front. Right? So that leads into the next option, which is not allowing payment plans or not having everybody understand that a payment plan is possible wherever needed. So if a patient can only pay a certain amount a month, and of course people have financial constraints of their own, and they may not be aware of how much a certain service is going to bring about in terms of financial commitment from them, then you can have them set up a payment plan where they're paying a certain amount a month. Again, keeping them in the habit of paying you as much as possible, and paying you regularly. Right? So a payment plan is also something as a feature we've added in CureMD where you can track with each patient. In their record, you can put in an amount that they're supposed to be paying every month. They've already agreed to this. Presumably, you've gotten more than a verbal agreement, so you've had some paperwork signed, and you've gotten them to set this up, and you've noted it in the CureMD system, so that every time you pull up that patient's account, you're made aware that this is something, this patient is on a payment plan, and they owe you something for that month. And of course, lastly, this is something that not everybody would choose to use. It's not something that's necessary for you to have, but we have practices who have this on site, so medical credit lines. You have, or you're in the business of providing services that are regularly not covered by insurance companies. Patients know this, or you make them aware as soon as they come in. And if it's going to be a large bill, and this is not something that we would always promote, but it depends on your particular practice, your particular need. But there are credit cards and credit lines that allow approval pretty quickly. and they allow your patient to set up a financial plan without having to resort to, or without you having to resort to building your own financial plans, right? You're not a financial institution. You're not going to be giving out credit. So you want that to be done by professionals, and that is an option. So medical credit lines are an option if that's something that would help your business close out balances and make sure that the patients are able to cover their commitments. Right? So mistake number one, not having enough payment options, everybody knowing what payment options you have. And financial policies. So these are policies that you make your staff aware of, you enforce them yourself, so you force yourself to make sure that you adhere to them as much as possible. And of course, you allow your patients to be aware in the initial documentation that you hand over to them when they first come in for a visit, in maybe notices that you have in the practice, maybe on your website, a financial agreement listing specifically, that patients will be acceptable, or they will accept responsibility for all non-covered services. They will accept responsibility for co-pays and co-insurance and deductibles, and they will try to make themselves aware. So they will be aware of their own policies and the guidelines in their policies that make a certain deductible due. So this happens very commonly, and Medicare patients come in, or patients come in over time, and they're like, we just paid our deductible, a couple of months ago. We remember we paid our deductible. Why is it due again? So some policies will have the deductible due in the beginning of the year. So Medicare is one of those. Some policies will have the deductible due when the policy is renewed on a yearly basis. So that could be in mid-June if the policy started in mid-June. So a deductible can become due at that point. We're seeing more and more often that you may have a deductible become due when a particular service is rendered. So surgical services have a deductible, but no other services have a deductible. So patients need to be made aware that they should be looking at their policies, they should understand their policies better, and where you are going to come in and make sure that you have a financial agreement on file where a patient accepts that responsibility. And of course, if you're accepting credit cards, then you're keeping credit cards on file as a rule with authorization to charge balances or charge for balances automatically when they become due. So it's something like where in the QRMD system you have an amount that the patient can specify. Let's say they're saying, you can charge up to $50 a month, or in a transaction, you can only, you give a date when that authorization expires. And so the patient is aware what you're able to do. You're not able to charge the credit card as and when you wish, but you have the card on file as a deterrent. So if they choose not to pay for their copay, when their copay becomes due or their coinsurance becomes due, you're automatically charging their card. And again, making sure that everybody's in line and everybody's aware that you have a specific policy and you're not going to let it slide. Right? So when you have the policies in place and when you have payment options in place, then you need training. You need to be aware yourself, and your staff needs to be aware of what the different responsibilities of the patient can be. So why do they owe a balance, for any particular visit? How can they look it up in the practice management system, in QRMD, in their records as to why a patient owes a balance for a particular visit? How can they look up where the balance is coming from? So did it apply to the last visit for the patient or something from last year? Or is it going to become due for today's visit because now the patient has a new deductible kicking in? Or, and this would help your staff resolving a dispute. As soon as something becomes a question, the patient says, I don't agree to this balance, you're immediately able to pull up records and be able to tell the patient, this is a deductible because you got a certain service the last time around and your insurance company doesn't cover it. We talked to your insurance company, or our billing team talked to your insurance company, and they verified that this is not part of your benefits. So again, resolving the dispute right there and then, not letting it linger, not letting that issue clog up other payments on that account. So enough training and being able to understand the system, being able to immediately resolve and satisfy patient concerns, that's another thing that you must ensure is happening. So not enough training is definitely a mistake. And there are many training materials, so you can definitely get help from your practice management vendor. So on the QRMD site or in QRMD when you're logged in, you have access to a help module, and there's training materials there. There's videos that you can look up online to see how to post a payment, how to look up balances. And then you can, of course, request support from staff members at QRMD, and they can guide you through how to do this. So when you have a new practice member joining in, a staff member joining in your practice, they should definitely be trained across the whole board of processes that they're expected to perform and how those things will work in that particular system. So they may be familiar with computers, they may be very web savvy, but they may not understand how something works in particular in CureMD. So that training will come in very, very handy, because when they go in and they try to look up something and the patient is getting a little annoyed, having the ability to immediately tell them as much information as possible is going to help you in the long run. Right? So everybody's trained in your practice, and you have multiple methods of payment, and you have very specific policies about finances and balances due and when you're going to collect them. And then the next thing is to be prepared. Right? A little prep time always helps, whether it's an exam, it's a test, you're giving your driver's license test, whatever it may be. So in this case, a little prep time the day before, just to check on your patients for the next day. Are there any patients coming in who have a large balance due, who we've simply not been able to collect from in the past? Are there any patients coming in? And eligibility is something that we really, really want to enforce. So right now, it's becoming very, very easy to check eligibility. You can do so online through an insurance company's website. So you can log in, or you can get your own logins to their portal. You can do so through CureMD. CureMD can automatically check eligibility for a vast number of insurance plans. So if your patient is scheduled for tomorrow, on your scheduling screen, CureMD can automatically check eligibility and post that as a tiny icon telling you whether the patient is eligible or not. So you know whether their insurance would apply to that visit or not. But for more expensive services, for procedures, for things that would cost a lot more, for medical items, medications, vaccinations that you're giving out, you really need to know whether those vaccinations, whether those drugs will be covered by their insurance plan, by the patient's insurance plan. And the patient would really appreciate if you were able to tell them ahead of time whether something would not be covered and what they could expect as an out-of-pocket cost, right? Not knowing is one of the pieces of the problem. If everybody knew ahead of time what they were going to owe, that would make it much easier to plan for a payment, to make sure that they had enough money when they were coming in to bring in their checkbook or to bring in enough cash. So being upfront about what you learn through this eligibility check, whether you're speaking to insurance representatives over the phone, just so that you're confirming that this is a benefit the patient has or does not have, and being able to present the information to your patient, that makes a world of difference, right? Getting authorizations for services. So this is going to be a big issue for many practices. You're performing a procedure, you've done the work, the patient's seen you, and they go away, and their plan tells you that you require authorization. They were supposed to be informed before the service that the service was going to be rendered. So even if the service is part of their benefits, you may not get paid because you simply forgot to obtain authorization. And how annoying is it? Again, money on the table, service rendered, people prepared to make the payment, but this tiny oversight where you're not looking into the details prior to the visit that are going to cause you a loss of a significant amount of reimbursement that you could receive. So now that you're prepared and you have the policy in place, and you've trained your staff members, and you have different payment options, and there's very little that remains in terms of getting your patients to pay up, maybe you're not enforcing policy, right? So a patient comes in and somebody says, well, today I forgot my wallet at home. I don't have a checkbook. I don't have credit cards. I don't have cash. I'm coming in a hurry, and I have no way to pay you, so I'll pay next time. So there really needs to be, and you can make an exception to this rule, but enforcing policy means that you're being very, very strict about how often that occurs. Right? So your staff is told that they do not let a patient see you without paying up front, without paying their copay, without putting a credit card on file. And again, you can be as lenient with this as you want, depending on if all of your patients or most of your patients are very good about doing that, bringing in their checkbooks or bringing in their credit cards. But if they're not, and they habitually forget or inform you that they've forgotten or choose not to pay, then this would definitely help, right? You're getting your staff to ensure that they collect on the entire past due balance, everything that's due at that point when the patient walks in. If you're using the CureMD system, you'll notice on the check-in screen, the system tells you how much there is in terms of copay, if you noted that information in, but it also tells you specifically what the patient owes for previous visits. So there's a balance amount right there. And you can click on that balance amount and post a payment at that point as well. So what you're doing basically is you're training your staff to collect everything up front so that when you see the patient, this is now, the accounts due or the accounts receivables are 0. They owe you nothing from prior services. This is a brand new patient cycle, and you've collected upon everything that you could collect upon. So you're no longer sending the patient another statement and spending more money, or calling them up and asking for payment and spending time and money and effort, or putting them into collections and again spending time and money and effort, and maybe costing you, patient goodwill because you didn't choose to collect that when they came in for their visit. Okay? It's a separate issue if you don't know, but if you have a system which tells you right there and then how much they owe for their previous visit, then it should be a habit, and it should be really something that you enforce, that everything should be collected and paid at that point. Worst case scenario, you're charging the patient a copay, and this is something that's maybe frowned upon, or it's something that maybe isn't very easy to do, but you may have to refund a patient because the amount that you collected, and if you're collecting up front, let's assume you're collecting a copay or a deductible, you have to go back and refund the patient the next time they come in. But compare that with the fact that, not only are you spending additional funds sending them statements, but the patient may never come back. This may be their only visit to you. And if you call them up and say, you know what, we collected $20 extra from you, and this is, after 6 months we're doing a round of refunds and we're giving patients money back, that's a good feeling. This is a practice that comes back to you and tells you that you overpaid, instead of you chasing after them and saying, you know what, you owe me money, and we need to collect upon this, or you're going to get put into collections. So again, in terms of patient goodwill, in terms of the relationship that you'll have, you enforce policy. You have a very specific policy that everybody is able to see, so it's transparent. It applies to all your patients. Your staff knows that you're going to work a certain way, and that's how the practice works. So there's no mistakes, and everybody's on the same page regarding what needs to happen. Right? So you're enforcing policy, and everything is set up, and overall you're doing everything that you can to collect up front. Then you need to follow through on that policy. Right? One part of that was making sure your staff was following through, and they were agreeing to collect up front, and they were agreeing to talk to patients and tell them that they have a balance, but also making sure that you're sending statements regularly. Right? You're warning patients who are past due, and this warning may be just be in writing. So anybody who has a balance past 30 days or 60 days gets a sentence on their statement saying, you're 60 days past due. If this occurs for another 30 days, we may be forced to put you into collections. Please contact us at your earliest convenience and set up a payment plan or settle your balance. Or something more positive than that. But you're indicating to patients, and you're making sure that you're taking that opportunity to tell them that you're serious, right? And you take this seriously. And using collection services sparingly. So that means that you don't put everybody into collections, you don't put every small balance into collections, but you make sure that somebody who's repetitive about this, who has come in over and over again and somehow not, or managed not to pay you, who are not footing the bill even though they signed a financial agreement with you in the first place, agreeing to pay the bill, where you've informed them that this is something that their insurance company is assigning to them, that you've done everything in your power to have the insurance company cover the bill, and it's something that you are not liable for. You did everything that was possible for you to make sure that the patient was aware and informed. And at that point of time, you should use a collection service and make sure that repeat offenders are put into collections. So again, making sure that they're aware for other doctors, for other people, that they cannot let this balance slide. They can come back to you and say, you know what, this is a huge balance. We can only pay you a certain amount a month, and so be it. But letting that slide and letting them go away and not doing anything about it and letting that balance sit on your books and get older and older, and it looks like you have $100,000 in uncollected patient balances and you have no idea where to start, get that out of the way. Right? And that leads into the next point. Write down all balances that cannot be collected. So you may, based on past practice or based on discussion with your billing team, decide that everything that's 6 months or older, everything that's less than $20 maybe, and we've sent a statement and nothing's happened in response to that statement, we'll let that slide. Let's write that off because we can't collect it, and keeping it on our books is going to make things more complex, and we're not going to be able to focus upon the things that we need to focus upon. We need to focus upon the balances that we can collect, patients that are coming back in the next month or so, patients that we know we can reach, their addresses haven't changed, we can call them up if they have a larger balance. So having a policy in place, again, to track older AR. And right, so now you've done a number of things. You've made sure that you use every payment policy, or you have every payment option available to your patients to use. You've made sure that you're using or you're preferring things like credit cards and direct debit as opposed to paper checks, where there's no issue if the funds not being available when you're trying to cash that check. You put in policies in place and you've trained your staff, and everybody knows what the policy is, and that policy is strictly enforced. So everybody's on the same page in that regard. And you're also making sure you're following through. So everybody at the practice and your patients, they become aware over time. I mean, this is reputation that you're building, right? You're a good doctor. You provide services. You're very professional, and you're serious about making sure that in terms of finances, they're paying on time, and you're making every effort to tell them and inform them and make sure that you work with them where possible. And the other thing that you're doing, of course, the last thing that you're doing is attending these webinars. So you're making sure that webinars like this, where we're talking about collecting on patient balances, we're talking about trainings, we're talking about new features in the system, we're talking about all of these important things that are useful for your practice. It's in half an hour on Thursdays or Tuesdays where we would like you to come in, sit with us, have the appropriate staff members attend, maybe record the session or get a printout of the slides and keep them on you. Use them as a reference to when you have the next discussion with your support team or with your billing team or with your RCM team to talk about things that you need to have done in the practice, and use that as a bridge, as a stepping stone to improve upon that aspect of your practice. So attend webinars, do all of the other things that we're talking about, discuss this with your team, make sure everybody is on the same page, and hopefully, and we've seen this in practice, some of the best organized practices that we work with on a day-to-day basis, they do this as a rule. Make sure that you're following these steps, and you will have a significant improvement in your patient AR, in your patient collections. Right? So thank you to everybody for attending today. We're very appreciative of you taking the time today. We are going to, of course, we'll put up a recording of this session, and we're going to send out these slides or put them online so that you can download them and look through them at your leisure. We appreciate you coming in, and of course we expect or hope that you will join us again next week. And that's all from us. So any questions or concerns, you can email us at support@QRMD.com, and we'll be happy to talk with you and respond to you. This is Ken Edwards, part of the billing team here at QRMD. And again, we thank you for your attendance. Have a good day.